Welcome to the office. Jazim, how you doing?
I'm good, how are you?
Good. Welcome to the office, or welcome to Dubai. How can I help you?
So since 6-7 years, I'm having this lower back tight situation. So whenever I walk, sometimes a bit fast, my lower back gets really tight.
Low back.
Yeah.
When you walk fast or you walk long?
Yeah, I usually walk with some good pace. I mean, I usually don't walk slow.
Okay.
Or if I'm doing some kitchen work, for example, when I bend a little towards the front, my back starts getting tighter.
On the stove or the sink? Or the counter or anything?
Yeah, any counter.
Any counter.
Yeah.
So when you're going slightly forward,
Yeah.
you start to feel the tightness or pain?
I feel the tightness, because of which I feel like going and sitting somewhere.
Okay.
Otherwise, it becomes too tight and it becomes uncomfortable.
So what do you do? Just don't
I
do
just-
that movement?
Yeah, so I rarely cook, but whenever I try to,
Okay.
this happens.
Okay.
And now recently, I've been going to gym, so maybe because of weight training, I'm feeling that tightness a little even more.
How long have you been dealing with this?
So I identified this, I think 7-8 years ago. I did an MRI in 2020, and it showed an L4, L5, L5S1 mild disc bulge.
Okay.
The reason I took an MRI is because my right leg, thumb, became a bit numb.
Okay.
Yeah, but now that issue is not there. It automatically got resolved.
So no numbness in the foot now, or
No,
the,
but
or the
now
big toe?
since the gym, my right thigh, a little bit, when I touch here, it's not that I don't feel anything. I feel, but I can feel that a slight numbness.
You mean a buzz, pins and needles, or less sensation?
Yeah, less sensation.
Less
Yeah,
sensation. And you're feeling it on the quadriceps muscle here.
Yeah.
Okay, so quadriceps muscle is usually L2, L3.
Oh, okay.
Okay, no problem. But you're not getting any numbness down low.
No, nothing there right now. And then a year ago, I think it's all because of my weight problem, because I've been constantly gaining weight. I'm working on my eating habits.
Is it eating habits?
Yeah, nothing else.
So you live in Dubai now, right?
Yeah, I live in Dubai since 3 years.
Okay, and you're sitting, desk job, computer?
Yeah, I do sit a lot while traveling in the car. Office, not too much, like maybe 2-3 hours.
Okay, but you're not on a computer all day?
No, I'm not.
Alright, so you're moving around?
Yeah, I'm moving around.
Okay, that's good.
So I think it's my eating habit, which I'm currently working on with a different doc.
Okay.
So I hope I'll get back in shape. But then a year ago, I started having this plantar fasciitis thing.
Right side,
Yeah.
left side?
Both.
Okay.
Both. Like when I wake up in the morning, I can't really set my foot immediately. I have to wait a bit.
Plantar fasciitis, you're
Yeah.
feeling it on the bottom of your feet?
Yeah, or
Someone diagnosed you with that?
a few months back, I was in Manhattan, so I thought, okay, I'll go to a podiatrist. They gave me, since I was visiting, they couldn't do a long checkup on me, so they gave me this that heel thing, which I can put on my shoe.
You mean the heel, a heel pad that has a hole in it?
Not a hole. It's like a very firm, stiff sole.
It's a lift?
Yeah.
Or it's the whole insert?
Yeah, it's a whole insert.
I got it,
It's a
okay.
whole insert. That was a huge relief, because I was not able to walk much in Europe,
Okay.
and this really helped. That pain doesn't come often,
Okay.
but then at home I don't wear it,
Correct.
so naturally the pain comes back.
So that's not the fix, it's a Band-Aid, right?
True.
Okay,
So it's
so
like a temporary thing.
correct. So what I would suggest, are you wearing them today?
No, I'm not, because I'm wearing a flip flop.
I was gonna say, don't wear it this week that I'm working on you,
Sure.
so we can see the difference.
Done.
They're bringing a foot model so I can explain plantar fasciitis to everybody.
Sure.
And the way I was trained with all foot problems, right? Number one, anytime we're looking at extremity situations, right? Doesn't matter which extremity it is, always rule out spine or nerve irritation.
Okay.
Right? So we have to, if we're looking at the foot, we have to rule out, is the foundation, the sacrum, all that is doing, there's no interference there. If we're not getting the messages to that extremity, it doesn't get its power and information. That's one. That's the power component. Second component is the structural component. Structural component, we follow kinetic chain, pelvis, knee, ankle. Ankle or the talus is considered the keystone bone of the entire foot. Yep, 85%, the way I was trained, 85% of all foot problems, including fasciitis, starts from a misaligned talus. And so I'm sure we have a sprained ankle at some point in your history.
Yeah.
And I'm sure I'll find it. So we go through the order. When there's an inversion sprain, typically with an inversion sprain, there are 6 major misalignments that can occur, which leads to a dropped middle or second cuneiform. That thing drops and it irritates on the plantar fascia, so it's pushing on it. Long standing develops dropped arch, right? We get dropped arches, we get irritation in the fascia. It can also lead to heel spurs. That's another thing, okay? All right, what else?
I have this heavy breathing since a couple of years. I don't know if it's because of my overall weight situation and maybe my snoring habit.
Okay.
I don't know if it is something else because I never took a sleep apnea test or something. So I'm currently trying to work on my weight, which I believe is causing all these issues.
Okay.
So
Well, there's definitely digestion stuff going on we're going to talk about, and I'm going to make a few recommendations today for you, and you're going to see some, you're going to be pleasantly surprised.
thank you so
Yeah,
much. That
you
would be
got it.
really
Yeah, you got it. Okay. Breathing.
yeah.
I'll check septum today as well. We'll check jaw as well. You do have a slight deviated septum we'll go over. Okay, so low back, fasciitis,
Yeah.
breathing,
Yeah.
and jaw.
Yeah, that's it.
Do we have a level base and foundation? So let's draw a few lines here and see what we got going on here. Base is not too bad. You have rotation of the pelvis. Okay. So about 6 millimeters of ion rotation on the right side. Let's check the sacral. 6.3. There's no sacral rotation as such, so that's good news. The number one thing I'm seeing here is the IN ilium on the right side. So what is it doing? It's turning in on the right, turning out on the left. It makes this look wider. So the butt looks a little bit flatter on the right, left side comes out a little bit more. Okay? Let's go on let's follow it up now. Oh, you're in for a treat today with the digestion too. This is T12 floating rib. 1, 2, 3, 4, 5. This is the sacrum. Okay. What's interesting? It's the sacrum. So we have a slight tilt in the sacrum on the right side. It's tilting down a tiny bit, okay? And that downwards tilt is causing the slight curvature to the right side. It's very slight though, it's very subtle. It's very subtle. It goes up, 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 up. And then right when we get to about the middle of the back in between the shoulder blades, that's when the spine starts to kink a little bit to the left side. T1, T2, T3, T4, T5, T6. T6. I do see that there's a slight tilt to that left side, okay? And this is the area that controls stomach, one of the areas that controls stomach. This is compensation from the middle of the back. We get to the top over here, so it curves, it's very subtle, curves a little, and then your right side has to kink up a little bit on the upper cervical. Overall, it looks like mild compensations coming from low back, but more important, as you know, is your digestion. And what I see, are you veg, non-veg?
Not much.
Okay. So what I see here, if we take this out, is when we look at the digestion, first thing we want to see is the meganblasia. I don't even see it. The gastric air bubble. There should be a big black half circle here. I don't see it. Maybe that little piece is it, but it's not enough, right? It tells me you don't have enough stomach acid. So when we're looking here, when we're going up the colon, we have a lot of undigested food going through the colon. By the time it comes out, we call this the permeated moth appearance. It's not absorbing and assimilating. You're not absorbing and assimilating your nutrients as well as you should. Now, let's look at the side profile and see, we have an old tailbone injury right there at S5. There's a little bend right there at S5, a little bit open on the coccyx. I'm sure we're going to find something S5 coccyx area. Okay, let's zoom out. Let's look at the overall appearance of the X-ray. And yes, okay, so what do we see? We should have a 40 to 60 degree curve in the neck, 60 degree back curve in the mid back, 60 degree forward curve in the low back. We have a decent curve here, but then we have a sway back, 5 starting at L4. And the sway back, if we draw a posture line from the center here, you can see it now. This line should be going through the base of the neck here and C2. So what is a consequence of this? The upper part of your building is behind the foundation. So the muscles in the shoulders and neck get tight when you sit long time. Right?
Yeah,
they get tight. So the idea is work on foundation, tailbone, get this thing moving forward and get you walking better.
Yeah.
Now, when you said L4, you said L4. L4 is tilted back. L5 is tilted. Watch this. L5 tilts back. L4 tilts back. 3, 2, 1, 12. 11 has a little bit of spurring, not spurring, but lipping. You have a little bit of calcification here. It's trying to fuse because of the instability, because you're going back. So what's the body naturally trying to do? It's trying to cement it to hold it in place so you're not back so much.
So my natural standing posture is a bit swaying in the back.
Correct, that's the sway back.
Yeah.
Now, as we work and fix that, you will probably get a little bit of sound in that area.
Okay.
That's the body resorbing. Okay, maybe you get little clicks for
Got it.
a few days, a week, a month,
Got it.
something. Okay? Now, as we go, but here's the good news, your discs are great.
Okay.
Discs are fine. Tilted, but fine.
Okay.
These discs are good. These discs are good. These discs are good. Now, when we look at your neck, it's a little bit straight. And it's a little bit straight because of the sway back. Follow. Okay. Discs are fine, by the way. Okay. Now, let's look at your upper cervical X-ray and see. All right, so right side, left side, we do have that jaw deviation, okay? You can see when you open, it kind of deviates to one side. Right side deviate, left side compensates. Septum, you can see the right side, the airway, the black line, right?
Yeah.
That there's clear. Left side looks a little clogged over here.
Yeah, I feel that.
On the left side, okay. We'll probably work on the septum today too. All right, any questions on the X-ray?
No, I think we covered it.
No. Did we get a foot model?
Yes.
Pass me the foot model. Let's explain this foot. Ooh, that's an interesting foot model. Okay, yeah, this is a little different than what I have. That's okay. We can explain it this way.
Okay.
Plantar fascia. Okay, well, you have the plantar fascia here, right? You have the plantar fascia that covers like this. Now, if we go in order of misalignment of the foot, talus goes anterior, fibula goes posterior. It can also roll. Calcaneus will go posterior, lateral. It will cause this to ride up. This rides up, can cause the cuboid to go superior, navicular to go inferior. All this creates hypermobility of the midfoot. Then what happens with that hypermobility, there are what are called cuneiforms. There's 3 of them. The lateral, middle, and medial, or 1, 2, 3. So 1, 2, 3. The middle one, the one that the number 2, which articulates with 3, the 3rd digit, will drop inferior. Now the shape of it, that second cuneiform is trapezoidal. So being trapezoidal, it's big on the top and it has this little, right? It has this point at the bottom. It can't go down unless there's hypermobility, right? So fasciitis, or that cuneiform, we'll check it on you, is usually a result, not a cause. It's very common, guys, where we have a symptom and the symptom gets labeled as a diagnosis. And then we're treating symptoms, thinking we're fixing a diagnosis. Does that make sense?
Yeah.
So the idea is going back to root cause.
Got it.
Okay, questions?
No, I'm good.
You ready to get started?
Yeah. Chalo.
C7, sit back please. Sit up, put your legs out a little bit. There you go. Left ear down. Good. Gotcha. Sit straight for me, please. Let's rescope, and then we'll continue. Let's check it out again. Seven is clear. 1 was on the right. Point on the left. I'm not messing with the upper neck today. Alrighty. T7 is clear. That's L5, dude. Tailbone is clear. I'm sure we're going to go to L5 on the next one. Come back slowly. Let's feel S1, S2, S3, S4. Different?
Yeah.
S5. That's the one we did. All right, let's go on your back over here and start checking out your feet. So for the first adjustment of the feet, I'm going to go through the misalignments. We're going to start on talus probably and fibula, most likely. But let's see what we find. And let's look at the talus first. And I'm doing dorsiflexion, lateral side. That side is good, yes?
Yeah.
Medial side. Right there. You feel that?
Yeah.
So when I go dorsiflexion, lateral side goes nice and easy. You can, hopefully you can see it. This side goes easy. This side doesn't.
Yeah.
Okay? So we have an AS talus medial tilt. Second is the fibula. Fibula is posterior, doesn't go anterior. Next is the calcaneus. Calcaneus has a little fixation on the posterior lateral side. Next is navicular. Right there. Okay. Next is cuneiform. So if you come back over here, I'll show you the cuneiform. Coming off the digit, we're going down. Right there. So if I push there, feel that there? Anything there when I push?
Yeah, it's not hurting, but yeah, I can feel something's there.
Right there.
Yeah,
I feel it right there.
yeah.
That's the cuneiform. So if I come down, feel my fingers. I'm trying to push it up.
Okay.
You feel on my thumb side. It comes down on my finger side. Right there. Okay. Let's check the other side. So today we'll do the medial talus on the right foot. On the left foot. Yeah, I mean, it's there too. Right? Right there. Alright. Bilateral AS talus medial tilt. Posterior fibula. Superior cuboid. Calcaneus posterior lateral. Inferior navicular. Coming off the third digit. Coming down into the fascia. This side isn't bad. Okay, you feel when I do this?
Yeah.
And this one has the dropped cuneiform, this one doesn't. All right, so I'm just using a little gua sha tool just to start, then I'll use my fingers. I want you to hear this, check it out. Listen. That's scar tissue. Okay, let's do this side. You feeling this, right?
Yeah.
Yeah. 5, 4, 3, 2. Okay. Now, let's do a little more with the hand. Over. Whatever you can handle, okay? Bear with it. Yes, over here. 5, 4, 3, 2, 1. 5, 4, 3, 2. Passive range of motion. Let me do the work. Let me do the work. Let me do the work. There you go. It's a good thing I had a nice workout today, dude. Whew. Alright. AS talus, medial tilt. Like butter. Good job. Posterior fibula. Left leg up. Oh yeah. Juicy. Yes. 3. If it's too much, I'll stop, okay? 3, 2. 3, 2. Plus. Let's set this one. AS talus. There you go. Nice. Let's do a little more with the board. Posterior fib. There you go. Okay, come on up. Walk it up, check it up. What's different?
I'm able to place my feet fully.
You're planting better, right?
Yeah.
Okay. Keep walking. I would say don't use those inserts this week.
Okay.
Please.
Yeah.
Have a seat. Drop the elbow down. Left shoulder. Let's go on your back over here. Let's get that nose job. This is the right. This is the left. There it is. And then puffy on the maxillary sinus. Not there, there. Left deviated septum, left maxillary sinus bone. Let's start here. There's the bone, meets the cartilage. So that's the part I'm working on. Let's bring the nose over. Just breathe through the mouth. Chin down. Oh. Gotcha. Look down, holding the right. There you go. Breathe in through the nose. Breathe in. There you go. Nice. All right. Walk off that nose job. Awesome. Then have a seat. Vibration therapy for scar tissue. Awesome. Stand up, sir. Let's check the hands. Squeeze. Elbow. Wrist. You got a little mark there on your nose, I'm letting you know, okay? I don't know if it's from your, no, it's from me. Yeah, it's from me. Let it go. Shrug. Let it go. Drop it. There you go. Gotcha. Squeeze. Less. Lunate. Scaphoid. Squeeze. Last one, turn. Ears. Cut this. Okay. You're all set for today. You're very welcome.
Thank you.
Any questions?
No, I think after a long time I'm standing like this with I can feel a full feet ground when that feeling was long gone.
You haven't had that in a while.
Yeah, because I always try to, keep a bit of my feet on the ground because it was in pain.
Okay.
But now I'm like, yeah, this is how I used to walk.
Awesome. Welcome.
Jazim, how are you?
I'm good.
Welcome back.
Thank you so much.
So I saw you last month here. We're in Dubai
Yeah.
at Al-Tadawi Hospital. Give a shout out to them.
Yeah. Great job. Finally.
So saw you a couple of visits.
Yeah.
What did you come for?
I came for my lower back pain. I thought I have this, one of my nostrils a bit blocked, and plantar fasciitis.
Okay.
Yeah, I was having so much of pain while walking. So I had this orthotics inside my shoe.
Correct.
Yeah. So since our last visit, I'm not using it.
And has there been any change? So I saw you a couple of visits last month.
Yeah.
I'm seeing you now. I saw you one visit before.
Right.
Tell me what's different in just a few visits, if anything.
Yeah. So I'm not using orthotics anymore.
Okay. And did it get worse taking out the orthotic?
No, it did not.
Interesting.
So without orthotics, it used to be a lot of pain while walking. Now I don't have pain after the adjustments.
Hold on. So there was pain walking with orthotics?
Without orthotics.
Without orthotics.
Yeah, without
and when you
orthotics.
had the orthotics on, you were walking fine?
Yeah, I was walking fine.
No pain after or during?
No, I mean like 90% I'm okay.
Okay.
Now after the adjustment, the pain has eased without orthotics by 50%.
Okay, good.
Yeah.
Good.
So yeah, it's a good development for me also.
Not bad.
So now, it's been a month, no orthotics, and I'm able to walk. I don't have this issue of, usually I want to sit somewhere while I'm walking.
Okay.
Yeah, without orthotics. Now I'm not sitting anywhere. I can continue with my work. I'm able to do my gym. So things are smooth with my feet. Lower back, it used to get really tight and a bit painful when I used to work in the kitchen or in the gym.
Okay.
Now, it's getting tight,
but it's not translating to that extreme pain which I used to have before.
So it's still, and I didn't fix everything. That's
Yeah,
okay.
yeah, I know.
But in terms of it takes longer before it gets tight.
Yeah, so it takes longer, and once the sensation comes that it's getting a bit tight, it doesn't escalate fast.
So the intensity is less.
Yeah, intensity
duration
is
is less.
Yes.
Frequency is the same or less.
Altogether it's less.
Okay, right
because usually, for example, when I bend a little bit forward, the tightness immediately comes.
Okay.
And I'm already in pain. Now that intensity has dropped, that frequency has also dropped.
Okay, great.
Yeah.
Now, what's interesting in your case is we didn't do a lot, so to speak.
Right. Yeah, no.
Okay,
It's just
that's what's
yeah.
pretty cool.
Yeah.
Okay, we didn't do a lot.
Yeah.
I will be seeing you still over time,
Yeah.
but it's not like I'm doing a lot. Like I'm seeing you 4 or 5 times every time I'm here. Once,
Yeah.
maybe twice.
Twice, yeah.
Maybe,
Yeah, twice.
moving forward.
Right.
Twice is probably realistic for a couple months.
Got it.
Until you're at a point of stability.
Mm-hmm.
And then you're walking, you're not getting as tight as you used to, maybe 10, 15%, 20%.
Yeah.
Most important for me is the walking.
Yeah.
And because it's chicken or egg.
Yeah.
Was it the back first or the feet first?
It was the lower back first.
Yes.
Yeah.
And then it translated to the feet.
Yeah.
So if we get the pressure off there and get the foundation right, along with the foot adjustments, then guess what?
Yeah.
We get better, faster.
Got it.
But the lesson is also this. It's not just working on where the pain was. Because we had so many cases over the years of plantar fasciitis, and I've explained this in a lot of other videos, where it's a process to get to plantar. You don't just wake up with plantar fasciitis. It develops over several months to years. Okay?
Yeah.
So the idea is, as it's reducing, right? It's reducing because that's holding. Okay?
Got it. Yeah.
You ready to continue?
Sure. Yeah.
Yalla. Let's go. Starting at the base of the neck, 10 points, C6. Oh, yeah, that's a C6, 10 points. Maybe a tiny bit hiding out in C1 up top. And breathing was a little bit different also?
Yeah, it has improved. I mean, I'm not snoring, I think. I mean, at least the intensity has gone down.
Cool. We'll work on that today too, okay?
Sure.
T11, 12, 4 points, left side. Dude, you got just a tiny little bit down low. 4, 4. 4 points in the sacrum. Okay. Cool. Head down, please. Static palpation. Static palpation, we're looking for swelling, edema, and point tenderness. When we look in this area, he's just dry, all right? Yeah. Need a little more water, please. But the swelling is down tremendously in your mid-back. I'm actually happy with that. Let's check lower down. Right there. Come back slowly towards me. 11. Yes?
Yeah.
10? No. 11. All right, come on back. This is 5. 1. 2. 3. 2. This one?
Yeah, it's 2.
Or this one? 2. I think it's up higher. Right there. 2 on the right, 2 on the left. 3. Is it more tender here or here?
Bottom.
Then that's 3.
Yeah.
Yeah, 3. 11, 3, and let's check up top. Sit back for me, please. C6. Okay. Ready?
Yeah.
C6, left side. Chin back. Under, under, under. There you go. Gotcha. Hi.
Yeah.
Come on over. The reason I'm doing 11 first in the middle of the back, in his case, it'll give him a little bit more extension, so it'll be easier for the sacrum.
Okay.
T11 we're setting as a PR-T, posterior right, opposite transverse contact. 5, 4, 2, 1. Drop the belly button all the way down. That's the spinous, that's the transverse. Drop it down. Good. Gotcha. Why don't you stand and walk once and then come back down? That had a little bite to it. Cool. Just go back down. Drop the tummy all the way down, sir. Keep going. Good. Keep going. There it is. You see how much more I had to take you down? A little more. Keep going. There. That's it. Gotcha. That's the home run, baby. Come on up. Knock it off. Everything's good with your trainer?
Yeah.
No issue?
No problem.
Go. Back over here, have a seat. Let's re-scope. Eleven is clear. Tailbone is clear. Neck is clear. No, that's clear. It's a 1-point flutter. I'm not messing with that. Okay, brother. Let's go on your back over here and work on your foot, feet. So, same thing. Sock off.
So go, okay.
Yeah. So when we're working with the foot, first thing is breaking up any of the scar tissue, reducing the joint swelling, makes the adjustment a little bit easier. Actually, not easier, better hold value. Raise your right leg and down. Okay, so for a little bit of lotion, and we're just going to work out some of the scar tissue. You feel that, right?
Yeah.
Yeah. There we go. So what I'm doing here, oh, it's fun, dude. If it's too much, I'll stop, okay? But we got to do it. 5, 4. So I'm here, and you can hear it.
Yeah.
It's very gritty in here. Actually, I don't know if you can hear it on there, but it's very gritty in there. 5, 4, 3, 2, 1. Now, just work the periarticular swelling. That's okay on your hip when I do that, right?
Yeah.
Okay. Periarticular swelling, working towards the heart. Interarticular swelling is passive range of motion. As we're doing passive range of motion, dorsiflexion and web contact on the dome of the talus going A to P. A to P, dorsiflex. A to P, stop it. A to P, dorsiflex. A to P, dorsiflex. There you go. Raise it up. Need a little bit of help. Hold it. Bring it in. That's it. A little bit each time. Okay. Talus, anterior tilt. Posterior fib. Turn to the left side, please. Calcaneus. Other side, please. And let's do navicular. And stand up for me. And let's go face down.
Okay.
I'm going to work on the middle cuneiform.
Okay.
And then the fascia. Cool. Slide up a little more, sir. Raise this up. Okay, coming off the third digit. There's the dropped cuneiform, which rubs on the plantar fascia. Let the foot go.
Okay.
Nice. Yeah. I like it. Okay, now, no kicking, dude. No kicking. So what I'm doing is vibration therapy on the plantar fascia. Tickle?
Yeah.
Tickle or pain?
Tickle.
Tickle. Tickle's fine. Bring it in. So starting at the origin of the plantar fascia, which is the calcaneus, and working our way out. Raise your foot, down, raise your left leg up, down. Ba-da-ba-ba-da. All right, Jazim, why don't you come on up?
Okay.
Awesome. Walk it off once and then we'll do the nose.
Okay.
I'll change gloves. What's different, sir, as you're walking?
I think I can walk with my heels a little bit better.
You can heel strike first?
Yeah, I can, yeah.
Good. And in between adjustments and stuff, you're doing your PT, you're doing your exercises, roll it with a golf ball. If at the gym you have any access to vibration, do vibration on it.
Got it.
Okay, any of that stuff is fine. Come over here on your back, please. So the X-ray shows right deviation, but it shows the left side is more clogged. That's what's interesting. Come over here on this side, and let's check. This is left. That's right. I mean, they're better than before, that's for sure. We want to do the right side there. Okay, so we're on the right. Bring it over. Gotcha. Let's go to the other side, please. And a tiny, tiny bit there. Us. Nice. We're going to do the right maxillary sinus. I'm holding the left, pushing on the right. There you go. Nice. Sans le. Breathe. And out. Sweet. Okay. You ready to come up? So you're heading out right after today. So we will regroup then next month?
Next month, yeah.
Okay. It's a pleasure to see you.
Pleasure.
Any questions?
No questions. I think.
You're good, right?
Yeah, very good.
Okay. Let's do a little bit on the elbow. Wrist. Good. Squeeze. Well, enjoy your event.
Thank you.
And we still doing good here, right?
Yeah.
No. Right there. There. There you go. Squeeze. Bus. Squeeze.
Thank you.
You're all set, sir. It was a pleasure.